Did you know that lupus can cause a pH imbalance in both women and men? If you've been struggling with unexpected symptoms like skin issues, digestive problems, or even infections, your body's pH levels might be out of balance due to lupus. Today, I'm breaking down how lupus affects pH balance, the symptoms to watch for, and what you can do to manage it. If you're new here, don't forget to like, subscribe, and hit the notification bell so you don't miss out on important lupus-related content. pH balance refers to how acidic or alkaline your body fluids and tissues are. A healthy body maintains a slightly alkaline pH to keep vital systems functioning properly. But lupus, an autoimmune disease, can disrupt this balance, leading to various health complications. Lupus triggers chronic inflammation, which can make the body more acidic. Kidney involvement, also known as lupus nephritis, can disrupt electrolyte levels, making it harder for the body to regulate pH. Gastrointestinal issues caused by lupus can alter gut pH, leading to bloating, acid reflux, and discomfort. Some lupus medications, like corticosteroids, can also contribute to acid buildup in the body. pH imbalance symptoms can vary, but here are some key signs to look out for. Frequent yeast infections or UTIs, due to a more acidic environment in the body. Skin problems like increased acne, rashes, or dryness. Digestive issues such as acid reflux, bloating, or difficulty digesting food. Fatigue and muscle weakness, as electrolyte imbalances can affect energy levels. Bad breath or unusual body odor, which can be a sign of acidity or gut imbalance. And bone and joint pain, because acidosis can pull minerals from bones, worsening the pain. If you suspect a pH imbalance, here are some ways to get tested. Urine pH test, available as at-home test strips or through your doctor. Blood gas analysis, which checks the acidity of your blood. An electrolyte panel, to help assess if your body is struggling with pH regulation. And kidney function tests, which are important for lupus patients, as kidney dysfunction can cause imbalances. Always discuss symptoms with your doctor to get the right tests done. First, let's talk about diet changes. Eat alkalizing foods like leafy greens, cucumbers, avocados, and almonds. Reduce acidic foods such as processed sugar, caffeine, and soda. And drink plenty of water with lemon to help balance acidity naturally. Next, electrolyte balance. Maintain proper levels of magnesium, calcium, and potassium by eating bananas, nuts, and spinach. Consider electrolyte drinks without too much sugar if recommended by your doctor. Now, medications and supplements. Your doctor may adjust medications if lupus drugs are affecting your pH balance. Probiotics can help restore gut health and prevent infections. Then, stress management. Chronic stress increases acidity. Try meditation, deep breathing, or yoga to reduce stress. Finally, monitor and adjust. If you have lupus nephritis, regular kidney checkups are essential. Pay attention to how your body reacts to diet and lifestyle changes. Lupus is already a challenging condition, and a pH imbalance can make things even harder. But with the right diet, hydration, and medical support, you can help restore balance and feel better. Have you ever experienced symptoms of pH imbalance with lupus? Let's talk about it in the comments below. Don't forget to like, share, and subscribe for more lupus-related content.